climate change is likely to increase the frequency and severity of these natural disasters. In 100 years of activity, the Aga Khan institutions and their personnel have experienced many such disasters firsthand. We have seen and felt the human, physical and financial cost of catastrophes. However, these difficult experiences have also taught us the value of investing in disaster preparedness, mitigation and response. We see the UNDRR World Campaign for Hospitals Safe from Disasters as a useful tool in making sure that we all understand the need to be better prepared. In any disaster situation, the ability to maintain functioning health services is a matter of life and death. The success of a disaster preparedness effort depends on our ability to ensure that health facilities can perform these three vital functions: to protect the lives of patients and health workers by ensuring the structural resilience of the health facilities, to ensure that health facilities and services are able to function in the aftermath of emergencies and disasters, and to improve the ability of health workers and institutions to react to and manage emergency situations. I would like to offer a few observations on these objectives based on the experience of the AKDN, which owns and operates more than 200 private not-for-profit health centres, 12 hospitals and over 300 schools, as well as numerous other institutions. The AKDN also provides technical assistance and support to government facilities and systems in a total of 19 countries in Central Asia, Africa and the Middle East. Our experience has taught us to view disaster preparedness and mitigation as core components of our overall development approach. In the network, we use the term mitigation to describe the measures incorporated into physical infrastructure that increase its ability to withstand the worst effects of natural disasters. We use the term preparedness to describe the community's ability to plan for and react to these disasters. And we have learnt that preparedness and mitigation are not marginal activities. They are fundamental, cost-effective, and they save lives. All AKDN buildings are built to withstand the seismic risk of their individual locations. Code +2. Code +2, or simply put, exceeding the required safety standards. In the last 5 years, we've initiated a survey that includes every single network building in a risk area, mapping those risks and evaluating the resilience of each building. We intend to ensure that every single AKDN building will withstand the effects of natural disasters. We work within and apply the HEALBUILD framework for action in our programs. Since 1983, the AKDN has developed and employed state-of-the-art technologies, including modified versions of older, seismic-resistant, low-cost techniques in the construction of its health and education facilities. The network has ensured that technologies are not only used, but acquired and adopted by the communities in which we work, thus spreading the benefits of these simple, locally available disaster mitigation techniques. We've also initiated a program to stock key facilities with essential food, water and medical supplies, as well as communication systems for use during and after emergencies. And furthermore, we've developed training programs for communities at risk and health workers so that they're able to use these facilities and react to natural disasters. These facilities can therefore also serve as safe havens. Access to clean water is another critical component for post-disaster response, preventing the spread of communicable disease. And this is why communal water distribution systems should also be built to withstand these disasters. We're currently endeavouring to build access to transportation to all our programme areas, including safe helipads that would ensure rapid evacuation of victims and distribution of essential supplies. And let me share with you the AKDN experience in Kashmir, where we've been implementing a multi-input programme since the devastating earthquake of 2005 in the Chakama Valley in Pakistan and in the Uri Block in India. In the particular programme areas assigned to us, all health units and schools had been partially or totally destroyed. When reviewing the aftermath, we thought it would be irresponsible to rebuild the health clinics and schools without first obtaining a better understanding of the levels of seismic risk for each institution. So resisting the pressures to rebuild this critical infrastructure quickly we commissioned a series of micro-zoning and geotechnical studies to evaluate the safety of their original locations and to identify safer sites if necessary. This allowed us to categorize the overall program areas by level of relative risk and to identify the types and probability of localized hazards, such as flooding and landslides. This analysis provided other concrete benefits. Firstly, we were able to demonstrate to governments that many of the original clinics and schools should never have been built at their original sites. And along with this, the very sad experience of having a newly rebuilt health facility wash away in a mudslide led the Pakistani government to issue a decree stating that no public buildings could be reconstructed before a risk assessment had been undertaken for any proposed site. Secondly, sharing our risk assessment with local communities allowed us to discuss and develop a disaster preparedness program for them. Indeed, after they acquired a better understanding of the potential risk to their health facilities and schools, the communities in both India and Pakistan program areas donated safer land for the reconstruction of public buildings. Thirdly, the seismic analysis have enabled us to design and build new health facilities and schools, incorporating seismically resistant features responding to the conditions of the site. But what happens inside a health facility is more important than the physical building itself. Ensuring that health facilities and services are able to function in the aftermath of emergencies and disasters is only possible if the health system functions well before disasters strike. In many critical situations, air access is the only means of reaching stricken areas, and it's essential that as much information as possible is made available to the air services, such as availability of fuel, coordinates of landing areas, access to spare parts, etc. And this is particularly critical in the interfacing between military and civilian infrastructure. The private sector can play an important role in strengthening health systems and in developing technologies and programs that promote disaster mitigation and preparedness. The AKDN's efforts to re-establish the health system in disaster-affected areas has allowed us to interact closely with local and central governments to introduce better clinical and preventive programs. We believe that these activities have positive impacts on the health status of the affected community. Partnerships between the public and private sectors in healthcare can provide new dimensions of complementary and collaborative work aimed at improving people's health. The experience of our network underscores the need for new thinking that emphasizes disaster preparedness and mitigation, as well as supporting the continued functioning of critical health facilities and systems. These are means to save lives and to reduce destruction to infrastructure and livelihoods. In the network areas of operation, disasters have taken place or will certainly occur in the future. We believe that we've developed some robust means to prepare for and ease the effects of these future disasters. We also know that implementing these measures is cost-effective and essential to safeguarding investments in infrastructure and human life. When disasters strike, many look to government, the international and intergovernmental and non-governmental agencies. However, the private sector's involvement in both preparedness and response is equally important. As I wrap up, let me emphasize once more that perhaps one of the most vital lessons the Aga Khan Development Network has learned in the field is that disaster-resistant health facilities, staffed with well-trained personnel and capable of functioning in situations where all else seems to fail, are key to saving lives. Helping the world understand that is a noble cause. I wish much success to this campaign.
Thank you.